The last part of Chapter 6 talks about automated external defibrillation and how to use it. So remember that an AED, it's an electronic device. What it does is it analyzes a heart rhythm and it lets you know if a shock is necessary. And if it is, it delivers the shock and corrects one of the abnormal electrical disturbances. Sometimes you have to use it more than once, but it attaches to the person's chest and it has a built-in rhythm analysis system. It records a person's heart rate, shock data, and any other information. It has an on-off mechanism. There's a cable with a couple of pads. There is an ability for it to analyze the rhythm, and it defibrillates the heart by delivering a shock in order to shock it back into a normal rhythm. It gives you prompts to let you know what to do, and it is run by battery, so it's portable. Only use an AED if the person is unresponsive and not breathing. Power it on, expose the person's chest, and apply the pads to the person's chest. There are directions on the pads, but if you are trained, you will know exactly where to place the pads. Stand clear, and if advised, press the shock button. If it analyzes that a shock is needed, it will tell you to press the button. If it tells you no shock is needed, then you do not press that button. Perform CPR and continue following the device's prompts. Some special considerations to think of. Water. If a person is in the water, you want to remove them. Dry the person's chest before putting the pads on. And there may be special pediatric pads for children available, as the size of their chest is much smaller. You have to be careful if there is a medication patch. Sometimes people are wearing it, some type of a patch to, for whatever medical reason that they have. You want to remove that before you attach the AED. There's some people have implanted devices called pacemakers or defibrillators that are implanted in the chest wall. Avoid placing the electrodes over any of those devices. Allow the unit to stop before using the AED. With AEDs, they need to be inspected periodically to ensure that they're working and all that the proper supplies are available. AED is useless if it's hanging up for years, never been maintained, and then try to use it and it's not working. So it should have regular maintenance, just like a fire extinguisher has to be maintained as well. There are different types of supplies that are included. There's 2 sets of electrode pads that come with it. There's an extra battery, a razor to shave the chest if needed, a hand towel to wipe dry, a breathing device, and some exam gloves. These are supplies that sometimes are included, or you may have to make sure are included with your AED so that you have everything you need to use the machine. There are different types of AED manufacturers, and different supplies are included with different devices. So you want to check what's available and buy the one that you feel is the best. They're all pretty similar. So very, very brief overview of CPR in Chapter 5 and AED in Chapter 6. Again, as stated previously, you must practice these skills in an environment that provides training in order to maintain a certification in CPR and AED, and also to be able to use this if you're going to provide first aid.